Order, order. Henry Smith to move the motion.
I beg to move that this House has considered blood cancer care in the NHS. Mr Wilson, it is a pleasure to serve under your chairmanship. And like many people in this room today, I have lost a family member to blood cancer. 5.5 years ago, my mother died from acute myeloid leukemia, also known as AML, in an extremely short time after diagnosis. And I've been touched by the many stories of families in Crawley and indeed nationwide who have contacted me to share their own experiences of losing a family member to blood cancer. With conditions such as AML, there is an incredibly short time, sometimes just a matter of days, between being diagnosed and this form of blood cancer taking a life. It's with these stories in mind that in 2016 I was pleased to set up the all-party parliamentary group on blood cancer, and I'd like to place on record my thanks to all colleagues, including those who left Parliament last year, for their work in getting the group up and running and in starting our inaugural inquiry on NHS blood cancer care. While the inquiry held last year and the report, which is to be launched in the Palace of Westminster right after this debate, will focus on the implementation of the cancer strategy for England, we are keen to learn from examples of good practice in Scotland, Wales, Northern Ireland, and have made approaches to the devolved administrations accordingly. I'd be delighted to.
I'm grateful to the Honourable Gentleman for giving way, and I would like to talk about a Welsh example, which is my young constituent Emily Dunn, who was diagnosed at 16 and sadly passed away subsequently. But during the period of her illness, her work in setting up the Remission Possible initiative resulted in 4,000 more people joining the stem cell donor register. Would the Honourable Gentleman praise Emily and indeed her mother Donna, who is continuing the work going forward?
Well, my condolences to Emily's family. There are all too many examples of young people passing away from blood cancer, and I do pay tribute to Emily's mother for a fine legacy. Sad that a young life has been lost to this condition, but wonderful that so much good work has been done as a result, and be grateful if the Honourable Gentleman would pass on my best wishes to them. And I, of course, would be delighted to.
I thank my honourable friend for giving way, and I'd like to congratulate him on the excellent work that he's doing in this sphere, because blood cancer is a bit of a hidden cancer, isn't it? And whereas if you have a solid tumour, it can be seen, it can be treated, you can see what's happening with it. With blood cancer, it's very difficult to be able to detect it. What is he doing to encourage early detection?
Well, the Honourable Member for Henley anticipates some of my remarks in a few moments' time, but he is absolutely right to use the word hidden cancer, and the nature of blood cancer is very different from solid tumour cancers, and actually that is a key point and a problem, I think, in terms of the understanding of this condition. What I was going to say, Mr Wilson, is that from 4 o'clock, members, honourable and right honourable members, are very welcome to come along to Strangers' Dining Room for the launch of our report. So, of course, I'll be happy to give way.
Join with others in praising him for obviously getting the debate today and indeed the report which will be published later. Firstly, can I apologise for having to leave because I'm chairing the all-party stem cell group at 3 o'clock, so everything's coming together at the same time. But would he agree with me that in this area and indeed within stem cell, there has been great progress that has been made over recent years, and we do not want to lose that progress. In a tight financial budget, we realise the health service is facing many challenges, but we need to keep the research going because there have been great progress in this area and we mustn't lose that.
Well, the Honourable Gentleman has a fine excuse for being able to have to leave this meeting early, and I endorse everything that he says. Future stem cell research is something that is absolutely critical. This country has made a good start in that, but we can't be complacent in any way, shape or form going forward. Our work, the APPG's work, focuses on blood cancer, as the Honourable Member for Henley said, a hidden cancer, and the difference between this and solid cancers such as breast cancer and prostate cancer, and the ways in which patient outcomes can be improved with government, medical professionals and local healthcare bodies working in partnership. Mr. Wilson, it's not an exaggeration to say that blood cancer is one of the great public health challenges of our time. We know that it's the third biggest cancer killer in the UK and the fifth most common cancer overall, and by far the most common cancer amongst people under the age of 30, as we heard from an intervention earlier on. Of course.
On that point, and I congratulate the honourable member for bringing this debate forward, but on that point of cure, would the honourable member celebrate with me the fact that one of my young constituents, Ellie Mae Watt, aged 12, was confirmed cancer-free November 2017, having suffered lymphoblastic leukemia and having been treated for 2 years for that. So there is, would he agree, hope, and there is, would he agree, a need to better finance research in blood cancer developments?
Well, I'm absolutely delighted by the news of your young constituents being cancer-free. That is wonderful to hear. And there are positive stories that we can draw on. Our former colleague, the former Deputy Prime Minister, Sir Nick Clegg, his son Antonio last year, very fortunately was given the all-clear from the blood cancer that he was being treated for. So thank you for highlighting those positives. A key factor in ensuring early diagnosis is a greater knowledge and understanding of the symptoms of blood cancer. Diagnosing one of the 137 types of blood cancer can be complex because symptoms such as back pain or tiredness can, of course, be easily misunderstood or misdiagnosed. Other symptoms for blood cancer include night sweats, weight loss and bruising, and again, in the first instance, can often appear similar to feeling run down or indeed having the flu, as was the case with my mother. We thought she just had flu for a couple of weeks beforehand and then sadly passed away in a very short time. Far too often, of course.
I thank him for tabling what is an extremely important debate. He talks about the trouble of diagnosing hidden cancers like leukemia in adults, but it's particularly difficult sometimes to diagnose cancers in children. Just before Christmas, I had a very, very sad meeting with a constituent of mine whose daughter, Isla Caton, has got neuroblastoma, which is a particularly vicious form of childhood cancer. And he discussed how it took 3 months to diagnose his daughter because of she was only showing some lethargy, and people have come up with various different diagnostic ideas on what it might be. In Japan, they actually test children from birth. Excuse me, I'm
It's
sorry.
just an intervention, it's not a speech.
Yeah. Excuse me, I just wonder if he would encourage things from birth to diagnose these sorts of cancers.
Well, I think my honourable friend raises a very valid point, and I mentioned about best practice for NHS England by talking with the devolved administrations. We also need to go internationally for that best practice as well. And what she says about the difficulty in diagnosis and people having to go to the GP many times before diagnosis is sadly a common story. And sadly, of course.
I'm grateful to you for giving way. On that point that you just mentioned about people and diagnosis, is there some weakness within the system that GPs are not diagnosing early enough? And if so, what does my honourable friend think should be done about that?
Well, I'm grateful for my honourable friend from Southampton for his intervention. Yes, that is the problem. I think one of the issues is just that the symptoms are all too often commonplace, particularly at this time of year. Many of us are suffering from colds or feeling tired or other viruses, and it's really a message, I think, to GPs, and I'll come on to this a little bit later on, that if one or more of these symptoms are being displayed, to consider that it could be blood cancer and to carry out what is a relatively simple blood test to try and determine that. Because, as I was saying, far too often blood cancer patients have to visit their GPs many times before being referred to hospital. Yes?
Certainly from my own experience, from my older son, he developed a platelet rash, which is a common sign of when the disease is getting to a certain stage. There's a lot of public awareness about meningitis, about what to look for, but that rash doesn't doesn't seem to feature in people's minds in terms of blood cancer. And would you agree that we probably need to do more to educate not only doctors, but also the general public in terms of what to actually look for? Because obviously the earlier the diagnosis can be made, then the better.
The honourable gentleman is entirely correct, and I'm sorry to hear of his own family's experience. The symptoms are often can be confused with others, and that's why it's important, and coming on from the earlier intervention, to stress that GPs should be given the support and the backing to raise awareness of the symptoms. And as I was mentioning, a simple blood test should be offered to assist with early diagnosis for people displaying one or more of these signs, and GP education and training needs to be improved to increase knowledge of blood cancer symptoms. Again, unlike an earlier intervention from my honourable friend, member for Henley, unlike solid cancer tumours, blood cancer cannot be surgically cut out, of course, and therefore blood cancer patients have a very different experience to those with other forms of cancer. Currently, blood cancer patients are not receiving the treatment and the support they deserve, and this is one of the key points I hope the Minister will take from today's debate. Of course.
I'm very grateful to the Honourable Gentleman for giving way again. Would he agree with me that one of the keys to treatment is about having as many people as we can on the stem cell donor register? There are 660,000 selfless individuals on it at the moment. We should thank them and also encourage those between the ages of 16 and 30 to sign up.
Well, the honourable gentleman, again, is absolutely correct. The stem cell register is vital to our addressing this condition going forward and beating blood cancer in the future, and I think we would all do well to echo the message that he has given to this debate on that today. I'd be delighted to.
I congratulate him for the tremendous work he's doing with the APPG and also on his superb speech, which I'm following closely. Mr. Gaziano, one of my constituents, has written to me to say that he suffers from an incurable form of blood cancer called chronic lymphocytic leukemia, which apparently is the most common form of leukemia in adults. And he makes the same point about the lack of support. Apparently 66% of people with this type of leukemia are living with anxiety, 50% with stress, 34% with depression, but they're not getting the psychological support from their healthcare team that they need.
The honourable member, my friend from Kettering, again, is absolutely right, and I'm sorry to hear of the experience of his constituent. Again, he anticipates some remarks I will be making a little bit later on with regard to support for people, psychological support for those with a more chronic, longer-term, what's sometimes called watch and wait approach to dealing with some forms of blood cancer, particularly in adults. The government and NHS England need to address, as a matter of urgency, Mr Wilson, the specific needs of blood cancer patients and to take immediate steps to improve their care. Something which may seem as simple as terminology surrounding blood cancer can have an effect on ensuring support for patients. And as I've said, there are 137 different types of blood cancer. We've heard a number of examples through interventions already, including various strands of leukemia, lymphoma, myeloma, just to name a few examples. In each of these, of course, there is one common word missing, and that is cancer. If you are told you have one of these forms of blood cancer, there runs a risk that the gravity of your condition may not be comprehended fully, and because just of the lack of this important word. And our report found that clinicians and patients said that the increasing use of the overarching term blood cancer has helped patients who have been diagnosed recently to gain a greater understanding of not only how the disease is part of a wider clinical area, but there is also an entire community of health professionals, charities and patient groups to help them. And I am grateful to all of those who took the time to respond to our web consultation and answer questions, including those on the subject of early diagnosis. After analysing the responses, the APPG's report outlines 3 main audience groups where increased awareness could help benefit patient outcomes. For the general public, while greater awareness of the symptoms would lead to people seeking medical intervention sooner, I also appreciate that the words of caution from some in the medical profession who reiterate that this must be handled carefully to avoid undue concern, particularly given the commonality of symptoms. And where there is agreement is that blood cancer awareness is far behind that, as again we have heard from interventions of other common cancers. For GPs, recognising and diagnosing blood cancer symptoms can be difficult, and for many patients, they reported frustration in having to see their GP a number of times, again, as we have heard accounts of, before their blood cancer was diagnosed. And for cancer policymakers, as I turn to the Minister, we heard that blood cancer was not at the forefront always of their minds, and as such, we see that policies and initiatives designed to ensure the broad benefit to patients with solid cancer tumours are extended to those with blood cancer. Much of the work on blood cancer awareness is undertaken by the charity sector, and to this end, I would like to pay tribute to the Spot the Leukemia campaign organised by Leukemia Care, and I'm pleased to say supported by my local community through Crawley Town Football Club, who made this cause their charity of the day at a game just last September. And I'd ask the Minister for his assurances that the Department of Health will engage with such campaigns to ensure that the full power of his department and the NHS can be used, not only to work in partnership with such charities, but also to give greater consideration to non-solid tumour cancers when developing policy. Mr Wilson, if blood cancers are taken into greater account, it will lead to improvements in the patient experience. Again, coming on to the earlier intervention, the blood cancer patient experience does differ from those with other cancers. The sad reality is that in some patients with some chronic blood cancers, they will never be cured. They will instead require treatments for the rest of their lives, with the cancer managed as a long-term condition. Patients who have had access to a clinical nurse specialist have been clear on the role that a CNS has on the patient experience. Indeed, respondents to the APPG's report were clear that access to a named CNS was the single most important factor which improved their experience. Again, the charity sector is working to support patients in this area. By April, the Anthony Nolan Trust will have funded 9 CNS posts in stem cell transplant centres across the UK, and these specialists provide support for patients, including assistance in getting back to work or school, as well as dealing with the physical and emotional aspects of a stem cell transplant, a potentially curative treatment, as we again have heard, and I'm grateful for the intervention, treatment for blood cancer. Some patients will be put on a programme that I mentioned earlier on of watch and wait. This literally means that a patient's blood cancer is monitored, and it can sometimes take years for it to reach a point where treatment can start. The very nature of such a scenario will place an unbelievable pressure and strain, not only on the patient fighting that cancer, but also, of course, on their family and friends and wider support network as well. Tailored psychological support, and I'm grateful for my honourable friend for raising this point, needs to be made available for patients, particularly on that watch and wait regime. Of course.
He talks about the wider strain beyond the physical, and I wonder if he also would agree with me that there's actually a huge financial strain that's often placed on families. I refer to the case I raised earlier where they have to spend a lot of money on takeaway food, congestion charge, parking, hotels, just to receive what can be very intensive treatment.
My honourable friend is absolutely right to raise the spectre of the financial burden as well as the psychological pressure that patients and their loved ones face when undergoing treatment, as say often expensive visits into London or to other major cities, centres to have their treatment undertaken. And I pay tribute, and I'll do this a little bit later on in my remarks as well, to organisations such as Macmillan, who do amazing work and are very worthy of our support in that area, obviously not only for those with blood cancers, but indeed all chronic and terminal conditions. And I'd ask the Minister, Mr Wilson, for his assurances that, as recommended by the cancer strategy, that all blood cancer patients have access to a clinical nurse specialist or equivalent model of support. One of the points raised in our two oral evidence sessions, which we held last September, was indeed the work of charities to provide support for patients and their networks on issues not always relating to treatments, as my honourable friend said, such as financial advice. There is a lot more support that needs to be given to patients and their families so they can devote the time and their energies to actually getting better. And there is a number of organisations that I've mentioned today, but I would reiterate again the fine work of Macmillan. Macmillan, for example, offer help to cancer patients and their families up and down the country. And just in my own constituency of Crawley this week, they will have one of their information hubs, which will be open in the County Mall shopping centre until Saturday, and their staff are on hand, as they are all the time, to answer questions about symptoms, side effects, or any other issues relating to supports locally. Mr Wilson, we can be thankful that an increasing number of blood cancer patients are living for many years after their diagnosis, and I thank honourable members for some of those examples from their own constituents. The cancer strategy says that all cancer patients will have had access to the recovery package by 2020, and this helps patients after their treatment is finished so they can return to their normal lives as much as possible. Of course, there must be recognition of the fact that patients can go from having regular access to a healthcare professional while receiving treatment to seeming like having no support at all after treatment ends. And it has been described like falling off the end of a conveyor belt with no one to talk to about their after effects, dietary needs and everyday activities that they had enjoyed before treatment started. To come back to the issue of how blood cancer is different to solid tumour cancers, I hope the Minister and his colleagues at the Department of Health will work with NHS England to consider how all patients can benefit from aftercare support, including ensuring that the recovery package takes into account the differences. To go from, in some cases, constant access to a CNS during treatment, including communication being available by mobile phone, emails and text, to support coming to an end when a patient is sent home is of course difficult, and there are long-term effects of blood cancer which need to be taken into account. In particular, for patients treated with a stem cell transplant, the transplant itself is only the beginning, of course, of a long journey to rebuild their lives. By 2020, it's thought that there will be more than 16,000 people post-transplant, and a significant proportion of these people will be experiencing long-term side effects of their treatment. They'll require specialist support, and it's incumbent on us to ensure they receive it with greater consistency across England. Mr Wilson, moving on to the issue of a new treatment access and research on the differences between blood cancers and solid tumour cancers, it's important to remember how blood cancers are often not treatable using surgery or radiotherapy. Therefore, blood cancer is more dependent on the development of new drugs and being able to access them in order to continue enhancing patient outcomes. The process of how NICE, the National Institute of Health and Clinical Excellence, and the drug manufacturers negotiate can also affect patients. Where NICE has offered a negative draft guidance on a particular cancer drug, which after further negotiations between NICE and the manufacturer changes to a final positive guidance, that period where patients are left to think that potentially life-changing or life-saving treatments may not be available can cause huge anxiety. And our report calls for the final negotiations to be undertaken before draft negative guidance is published. I've mentioned the work of the charity sector a number of times in supporting blood cancer patients, and this is perhaps most significantly represented by the financial investment made by blood cancer charities to fund research, develop a good research base, and ultimately produce relatively good survival rates. And I'd ask the Minister to ensure that further support is given to this research, not only to provide financial backing, but to ensure that blood cancer patients are at the heart of cancer policy going forward. Mr. Wilson, I'm conscious of allowing other colleagues the opportunity to make more substantive remarks if they wish, but on the subject of NHS commissioning, local decision makers should look for opportunities to bring care of chronic blood cancers closer to the patient where appropriate. And I'll be writing to my local CCG in Crawley to share with them a copy of the APPG's report, and I'd encourage colleagues to do likewise with their respective clinical commissioning groups. Mr. Wilson, in conclusion, I'm sure that all of us here today can name people in our local areas, as many honourable members already have, who have had experience of dealing with blood cancer in their family and working to raise funds for those who want to make life easier for patients and their support networks. In my own constituency of Crawley, I'm grateful for the work of the Mark Henry Archer Tribute Fund at Bloodwise, which was set up by my constituent Jane Archer in memory of her late husband Mark, who sadly lost his battle with lymphoma in 2010. I mentioned at the start of my speech that blood cancer is the most common cancer amongst people under the age of 30, and you can be in the peak of physical fitness and then it can still strike. Just a week into this new year, Juan Carlos Garcia lost a 3-year battle with leukemia. He was just 29 years old and a professional footballer who played in England for Wigan Athletic and at the 2014 World Cup for Honduras. Blood cancer, quite simply, can strike anyone at any time. And I'd like to thank the patients, advocate and medical professionals who took the time to come to Parliament and answer the group's questions at our evidence sessions, which I mentioned we held last September. My sincere gratitude also to Bloodwise for, as well as providing the Secretariat support for our APPG and assisting blood cancer patients up and down the country, and who play a leading role in research which is necessary to improve outcomes and the patient experience. I know many people in this room today will be aware of one family that has been affected by blood cancer in the last couple of months. The Sky Sports presenter, Simon Thomas, and his 8-year-old son, Ethan, lost their wife and mother, Gemma, aged just 40, last November. Just 3 days after being diagnosed with acute myeloid leukemia, the same form of blood cancer as my own mother, Gemma passed away. And incidentally, my own mother's diagnosis came just hours before her death. So our thoughts, of course, are with Simon, Ethan, and their family and friends, and all others, and every patient affected by this disease. It falls to each of us here, and I ask the Minister for his continued diligence in such matters to make sure that we redouble our efforts to bring as much help, comfort and support to blood cancer patients as possible. Of course, I've seen firsthand how quickly those who have blood cancer can be taken from us. And in a previous debate that I was fortunate to secure here in Westminster Hall on the 7th of July in 2016, I said that I look forward to ensuring that the issue of blood cancers is further advanced and that awareness is increased. Mr. Wilson, with the progress of the APPG and the colleagues here this afternoon, and those who will be attending the launch of the group's report afterwards, as I say, from 4 o'clock in Strangers' Dining Room, I'm pleased to stand here today and say that we are making great strides in this regard. There is much more to be done, and we will continue to make progress. Thank you.